Hello, my name is Michelle Smith, and I'm a regional practice lead in the research department in Interior Health. And I'd like to welcome our webinar guests today. We would like to respectfully acknowledge that UBC Okanagan is situated on the traditional, ancestral, and unceded territory of the Okanagan Nation. I would also like to acknowledge that you are joining us today from many places near and far, and acknowledge the traditional owners and caretakers of those lands. Welcome to the 10th Annual Okanagan Embrace Aging Month, and thank you for joining us today. We're very excited. It's the 10th annual. It's a good year. Embrace Aging is co-hosted by the Institute for Healthy Living and Chronic Disease Prevention at UBC Okanagan, Interior Savings Credit Union, and Interior Health. UBC Okanagan has joined the global network of age-friendly universities, formalizing its pledge to make UBC Okanagan more accessible, intergenerational, and committed to research programs that are informed by the needs of an aging society. If you'd like to know more about the Age-Friendly University Initiative, have suggestions for us, or would like to get involved, please contact the Aging in Place Research Cluster. Email aging.inplace@ubc.ca, website aginginplace.ok.ubc.ca. Embrace Aging Month was launched 10 years ago to celebrate and raise awareness about positive aging, and has once again organized a number of educational opportunities and events during the month of March. The sessions are designed for everyone, young and old alike, and focus on a variety of topics related to healthy aging and ways to improve quality of life among seniors and their family caregivers. Our goal is to inspire everyone to embrace positive aging. We have closed captioning. The closed captioning box can be moved to your preferred place by clicking and dragging it to where you would like it to be. And to turn it off, select Hide Caption button on the menu bar. For questions or comments for the speaker, place in the chat box during the presentation, and questions will be read at the end of the presentation. Today's event is brought to you with support of Embrace Aging Month. Today's session is Putting Pieces Together, Supporting Older Adults Living with Complexity. Our speaker is Shannon Paul-Jost, Clinical Nurse Specialist, Gerontology, and the Senior Specialized Care Transformation Department of Interior Health. I will introduce Shannon and share your screen. Does that look okay?
I can't see your screen yet, Michelle, but thank you. I'll just start by saying that I am residing from the Syilx Nation, known as the Central Okanagan in Lake Country. So thank you so much. I still can't see your screen, Michelle, so I'm not sure. I'm seeing Jackie's screen. Jaketta's screen.
Apologies. We're on it now.
Ah, there we go.
Is that better? Sorry about
Excellent.
that. Missed a button.
No worries. All right, well, I'll get going. So thank you for joining. And today I'm going to talk a little bit about what is PIECES and the person-centered approach that we are attempting to create within Interior Health, and our journey so far as to embedding PIECES into the work that we do in Interior Health. So next slide, please. Yeah, so there we go. So to start, I just want to talk a little bit about PIECES. So PIECES began in Ontario in 1997 in long-term care, and it was actually a response to a system-wide challenges that they were having with understanding and caring for older adults who are living with dementia. It is actually a best practice learning initiative that formed out of those challenges. And it really focuses on the complex physical and cognitive mental health needs of older adults, as well as some of the behavioral changes. Over time, since 1997, there's been changes to the program and how it's run and how it works, but it really has focused on fostering an integrative approach to care and looks at the whole person and how you can support an older adult with care. And the strength of it is it focuses on health promotion and prevention planning for that individual. And really it is anchored in performance quality and initiatives. So it's a wonderful program. Next slide, please. So what is PIECES? Actually, PIECES is actually an acronym, and it's the cornerstone of the PIECES approach. And it stands for the physical, intellectual, and emotional health of an individual. It focuses on the strategies that support an individual's capabilities, as well as their social and physical environments and their social life story or networks or cultures that bring some context and characteristics, the characteristics or attributes that that individual brings to the care that they need. Next slide, please. So the components of PIECES is one of the first components of the PIECES approach is the 3-question template. And this, the first question is, what are the priority concerns, or what has changed for the person? And once we start looking at what has changed for the person, we need to sort of unpack the risks and possible contributions, as well as the actions. So I'll go to the second question. Next slide, please. The second question, what are the risks? And see, these are the possible contributing factors that may lead to a person's behaviors or some of the things that we see clinically of how they're presenting. And so when we think about PIECES, we want to really think about what are some of those atypical presentations, and we want to avoid any assumptions. And so when we look at if we start to unpack the person's physical health, we want to look at things such as disease, delirium, drugs, any discomfort that they might have, and any disabilities that they might have. So those are the 5 Ds that we're really trying to unpack when it comes to the P in PIECES. In the I in PIECES, there are 7 A's. And so those would be amnesia, aphasia, agnosia, expraxia, altered perceptions, apathy, and asogenia. I can't pronounce that very well, so sorry, which is a loss of sight or an illness of insight in their illness and disease. And the last component, the E, is the emotional health. So those would be things such as an emotional disorder, mood or anxiety disorders, adjustment disorders, psychosis, or a personality disorder. And anytime we're looking at these components of an individual's presentation, we really want to be looking at assessing the risks. So what is the impact of the risks, and what is the probability of harm? And we use this probability tool to look at that as we start to look at an individual's health and how their health might be contributing to their behavior and what we're seeing in practice. Next slide, please. So as we're looking at risks and possible contributing factors, the C is what we're looking for with an individual is really their strengths and their abilities. So sometimes people become overwhelmed, and when they become overwhelmed, their behaviors might be expressed in a negative way. And so we want to understand what's happening with them, or they might have underutilized capabilities. And so really we want to understand what a person's capabilities are, what are their strengths, or what might be contributing to their behavior. And certainly we want to look at what has happened to this individual in the in the past as well as in the present. And we want to also explore with an individual their personal characteristics. Have they had a family influence where they used humor to cope with whatever they're facing? Or do they lean on spirituality or a faith system? And what other mechanisms have they used to be when they've been faced with something challenging, and have they used to overcome that? It's also important to look at what are some of the individual's support systems as well as resources that optimize their independence. So all of those will play a factor into their capabilities. The E in the pieces stands for the environment, both the physical environment and the social environment. So the physical environment would be things such as, are they in a place where they are experiencing overstimulation or understimulation? Have they had a recent move and or a change in their routine? All of these things will contribute to an individual's ability to cope and how they respond to their environment. And then the last part of the pieces is the S, their social. So their life story, their social networks, their culture, their values, sexuality, gender identity. We also want to focus on their past accomplishments or experiences, such as their work history, their social skills, their favorite places, or education. Next slide, please. And the final part of the pieces of the 3-question template are the actions. So these are things that we're going to investigate. So the screening tools or assessments that we're going to use to rule out, monitor, or determine what is contributing to any of their clinical presentation. The interactions, so what way do they like to be communicated with, and what is most supportive for them and their care partner. So that could be verbal or nonverbal interactions. And then finally, intervention. So this would be creating a holistic care plan, minimizing any risks, or preventing any unnecessary decline or reoccurrences, as well as supporting an individual during their transitions in care. Next slide, please. So now we're going to move on and look at how the pieces 3-question template and unpacking the pieces acronym will be applied in practice, and how we want to apply that to person and family-centered care. Next slide, please. So in 2020, Pieces Canada actually redefined and reimagined how pieces looked, and they came up with this beautiful infographic around the pieces approach. And really the why of the pieces approach is the person-centered care, and it really provides that using the framework and the 3-question template provides that common set of values and language as a team that we use to communicate that comprehensive approach to problem solving and enhancing the person's capabilities. And this approach also flags and detects any cognitive and mental health issues that may be associated with any behavioral change. And it helps us to coach and guide other team members as to how to think in a very systematic way to provide a comprehensive geriatric assessment. Next slide, please. So the other thing that Pieces does is it really helps us to focus on team collaboration when we use this approach. And really, when you use the 3 questions, what's changed, what are the risks, and how can we help, or what should we do, it really can be focused on any time and place. So it can be done in the moment or during huddles, in their urgent situations. Also, there can be times when we want to do think systematically and talk amongst team members as well as the individual and their family, and then share those assessments and how that might impact or inform a comprehensive care plan, as well as any care conferencing that might be needed, or help with transferring information as a person transitions from one care setting to another, such as moving from acute care to long-term care, or to a short stay bed, or those sorts of things. Next slide, please. So with the change that Pieces Canada made, they also changed some of the foundational principles, and these are more inclusive of the team itself and the family, and puts the person and family at the center of care. So the first principle that we want to adhere to is validating the individual and their family, and this is done through authentic listening to understand, and having communication that is open and respectful, and encouraging dialogue where individuals' concerns are validated, and that they're truly heard. And so then we move on to solution finding, and this is where the team uses that 3-question template. And so this is really to avoid any assumptions and minimizing the risk. It also looks to the entire team to bring together their knowledge of how the clinical presentation is of the individual, and to understand what all possible things could be causing the issues that they're seeing in practice, as well as looking at what are the strengths that this individual has, and how can we create an evidence-based care plan. And that leads to our third foundational principle, which is acting together. And so really the team is always constantly seeking a way to strengthen that person and family-centered relationship, always asking and confirming, do we have the right people here? Who's on your team? And ensuring that their input into the care is reflective of what the care is being provided and how that's being provided, and actively working with the person to meet their goals of care, especially during those transitions in care. And the fourth foundational principle is enhancing and translating knowledge. So this is really a commitment to using Pieces in practice and being a role model to model the Pieces approach, and using the 3-question template as a resource, and using all of these into care practices to inform how care is delivered, as well as looking at how, as an organization, can they implement best practices, procedures, and policies to ensure that comprehensive care is given at the time it's delivered. Next slide, please. All right, so I just want to talk a little bit, the next slide is, next slide, please, Michelle. Talk a little bit about Interior Health's journey. So just to put some context and perspective to things, Interior Health is quite a large health authority within BC. It goes east to the Alberta border, south to the US border, west to the Fraser Valley, and north beyond Williams Lake. Within Interior Health, there are 7 geographic areas. We have the East Kootenays, we have the Kootenay boundary, we have the Okanagan, which is divided into 3, South Okanagan, Central Okanagan, and North Okanagan. We have Kamloops, and then we have the Thompson Caribou rural or Shuswap area. The population in this geographic area is 820,000 people, and we have quite a, we have all ages, but the largest growing demographic is really that 75-year plus population group. And within this health authority, there are actually 7 First Nations, and so we have health settings within this health region in all areas, in urban settings, rural, and remote. So in the large urban centers, we have general hospitals. In the urban settings, we have general hospitals. In the rural settings, we have the general hospital. We have the regional hospitals. And then we also have other primary care and those sorts of things in the remote areas. Next slide, please. So why is using pieces important? Well, as I stated, we have a very large geographic area, but we also know that we have a growing aging population. And with this aging population, they have many diverse and complex needs, such as physical, emotional, and intellectual needs, as well as financial needs, and even needs at home or in their community. And so we want to make sure that in order to provide the best care for these individuals where they reside, that we are not only looking at them from a biomedical model, but we're covering all the other aspects that make that person whole. And we're including where they reside and who is in their circle of care. So, and the last thing I want to say is we know that as people age, they may need more support and care as they continue on their life's journey. And so this is why this topic is really important, and it's why we, endeavor to get it right within interior health. Next slide, please. So what did we do in interior health? So in 2012, there was a grassroots initiative led by mental health. We had a geriatric psychiatrist champion who really thought that pieces should be integrated into practice. She developed a team of people who were trained in the 3-day pieces workshops, and she brought that to interior health. She also helped create some buy-in of physicians to broaden that physician role to work as a team and look beyond their medical issues to support that person's care concerns. So this started in 2012, and the work continues to this day. Next slide, please. So some of the work that happened over that, over the last 10 years, is there were benchmarking set for training of staff, particularly in the acute tertiary mental health facility in Kamloops, where every new staff would be trained in the pieces approach. There was also benchmarking set in long-term care that there would be one trained staff person per shift. And in the new seniors health and wellness centers, all the staff that were orientated to that site, those 3 sites, they all had training in pieces. As well as there was some initial targets for older adults with behaviors with psychological symptoms of dementia. So there was a team that gets referrals, and they often will, if they're seeing these types of individuals that have problems with their behaviors, they also have the training for pieces. Next slide, please. So since 2012, we have trained over 1,200 clinicians with the pieces approach. There has also been an online pieces toolkit that was developed for clinicians to access, as well as there's a regional complex behavioral consultant group that supports long-term care with any behaviors that might be associated with dementia. Next slide, please. So to date, there's been some evaluation of the pieces training, not necessarily of outcomes yet, and that's where we're headed to. But with the training, the clinicians said that they felt more knowledgeable and they had more confidence in the work that they did. They really valued the systematic and comprehensive team-based approach to older adult care, as well as they really felt supported with their clinical assessments as they were using familiar evidence-based standardized assessment tools. And so once we were able to use this evidence-based approach, everyone kind of understands what frame of reference people are being assessed on, and then we can all support an individual and their families moving forward with, because we're all talking from the same, we're singing from the same songbook, so that it makes it really easy for good team collaboration, as well as for comprehensive care for older individuals as well as for their family. Next slide, please. So some of the next steps that we're planning on taking within Interior Health is really to integrate that pieces approach into orientation. So right now, as I said, it's in orientation in that tertiary mental health site and in long-term care, but this will be part of other parts of the organization, such as home health, and with plans to integrate it into acute care and primary care, etc. There is also support for continued and ongoing in-servicing training and workshops to ensure that we build capacity within our teams. And there is always a need for more experience, practice, and building knowledge through sharing stories, through case studies, and those sorts of things. And we really are focusing on coaching and mentoring and leading using pieces experts, so to build that capacity. And finally, we want to ensure that that evidence-based practice is available through tools and resources that can be used in clinical practice. Next slide, please. So the other aspect of the pieces that we're hoping to do up until now, this pieces integration has sort of been, sort of ad hoc when a team or an individual clinician thinks that there's more to this individual that they need to assess. But we're really hoping that this actually becomes a way we do business. And so we're trying to incorporate the pieces framework into daily practices. So looking at things such as how are we structuring our team rounds or care plans, our care conferences or care planning, and how do we have those clinical conversations, and can they be anchored in using that pieces 3-question template, as well as unpacking a person using that pieces approach. We also are needing to ensure that we consistently use those pieces assessment tools across the continuum of care, as well as ensuring that we have trained coaches to facilitate pieces and ensure that those can be that pieces can be coached through those clinical routines. Next slide, please. So one of the biggest things when you're implementing a strategy such as this within an organization is having leadership buy-in and ensuring that there's support for such an initiative and having it become an organizational priority. So at a system level, we do have executive director buy-in and support to change the system. So we have had support to establish geographic area teams in those 7 areas that I was saying, to make sure that we have trained clinicians that are at the ready in those clinical areas. Also within those areas, there would be coaches and mentors and that can lead by example and keep clinicians abreast of changes. There's also there's been some support to develop a community of practice of clinicians who use the pieces approach, so that this is an exchange of where people can share information and knowledge. There is acknowledgement that the pieces toolkit that's on that we currently use needs to be updated and reflective of a broader integration across the continuum of care. So that work will be done, as well as how do we communicate as a team. And so there will be there needs to be some work done for a better electronic health record for communication, collaboration, and to support those transitions in care. So this is where we're going. Next slide, please. And that's it. So I'll open it up. If there's any questions, I'd be happy to answer any at this time.
I can always put the screen back up too if anyone wants to look at more.
I think the last slide I had, Michelle, was the reference page.
I can put that back up.
If you have any questions or comments, please put them in the chat. I'd be more than happy to answer any questions.
There's the references, and it's on YouTube and will be it'll be recorded on YouTube on the channel. So you can always review, share later, and send in questions. Noja kind of forwards them on to confer them on to Shannon as well. I can put that up again. No questions for now. I'll have one. I just want to follow up for Shannon before we go, because I know we have a short call and we can follow up later. But so with the pieces too, we've been talking about that a lot with the long-term care homes with their their LTC plus quality improvement programming they're working on to connect what they're doing and use pieces, follow the pieces framework around bringing the family together with the resident and the staff in an interdisciplinary way to build the care planning and build it around the person. So I think it's fabulous what's going on, because we can just keep applying it in different ways.
Mm-hmm. And for long-term care, you know, we had a really great contingency of staff that were trained in the pieces approach, and really there's been some great headway for that. I think one of the unfortunate things is during the pandemic, many of those common practices are now on shaky foundation, because we've had such a turnover of staff, as well as maybe things that used to be routine aren't as routine anymore because other things took precedence. So we're trying to rebuild that in long-term care, and I think we will get there. Certainly any interaction I have with clinical staff, I am encouraging them to use the pieces framework and to use the 3-question template to really start to identify what could be what is really important and what's changed for the individuals, and how to make their quality of life better. And so, and there's lots of great tools that can be used to assess an individual, as well as, you know, when we work with teams and talk to their family and to the individual themselves and focus on their strengths, good problem solving can be had for improved quality of life for those individuals.
Nice. We have a comment from Caitlin. Don't have any questions. Just wanted to say thank you.
Thank you for attending, Caitlin.
Nice. I'm going to do that little wrap up part here, and you still have a few more minutes for questions. We'd encourage you all to attend other events scheduled for Embrace Aging, and please visit our website, OkanaganEmbracingAging.com, for all the events and registration. We look forward to growing this event in the Okanagan, and encourage anyone interested in supporting Embrace Aging in the future to please contact us. Contact information is available on our website. You'll receive an email with a link to an online evaluation form. We welcome everyone's feedback and suggestions for planning Embrace Aging events in the future. So I'd like to thank having Shannon on today. It's been really fabulous to hear all the good work you're doing. And I know it's a lot that's been going on, and it's just growing. So yeah. Shannon leads it all. She's got it all going on. So we're happy to have you here today.
Thank you for inviting me. Yeah, wishing everyone a great day. Thank you.
Thank you. Bye.